up in the next presenting author, Dr. Anusa K.S.
Good morning everyone. Today I'll be talking about efficacy of a novel technique, anterior chamber dialer divide for soft cataract management by phacoemulsification. Nowadays we are encountering soft cataracts more frequently due to increasing patient awareness, early identification and referral, evolving lifestyle requirements which are bringing patients earlier to the hospital. Soft cataracts are characterized by minimally dense endonucleus of spongy consistency with abundant sticky soft cortical material and well developed nuclear cortical back adhesions. Hence, removal of this type of cataract poses difficulty. Phaco within the capsular brach are prone to complications such as PCR, corneal endothelial damage, nucleus drop, zonular dehiscence. For all these conventional techniques to be performed safely and efficiently, an advanced phacoemulsification equipment is necessary. Not always there will be access to such advanced equipments. Therefore, we are describing a novel technique, anterior chamber dialer divide, for which an advanced phacoemulsification equipment is not necessary, and also for an efficient and safer nuclear fragmentation of soft cataract. Objectives of this study was to analyze and compare the intraoperative performance, postoperative outcome of soft cataract surgery performed with ACDD technique and conventional phaco. So it was a randomized comparative study with the sample size of 100 patients. We included nuclear color grade of 1 and 2, opalescence grade 1 and 2, cortical cataract of grade 1 and 2, posterior subcapsular cataract of grade 1 and 2, and with anterior chamber depth of more than 2.5 mm. And patients with pre-existing glaucoma, PXF, chronic uveitis, retinal pathologies, patients with traumatic cataract, complicated cataract, and patients with comorbidities like diabetes mellitus and hypertension were excluded from the study. All the patients were randomized into two groups using a lottery method, and patients in group A underwent novel ACDD phaco, and patients in group B underwent conventional in the back phaco. Intraoperative parameters like ultrasound time, effective phaco time, BSS volume utilized, surgeon's comfort were all analyzed, and follow-up was done for 3 months. About the technique per se, a 2.2 mm clear corneal incision with 1.2 mm side port was made, and capsular axis of 6 to 6.5 mm was done, and two dialers were introduced into two opposite side ports, one above and one below the nucleus in the same plane up to the edge of the nucleus, and nucleus is divided by simultaneous upward movement of the below dialer and downward movement of the above dialer, thereby cutting the nucleus into two halves. So the parameters were ultrasound time. In the group A, it utilized less time when compared to group B, and the difference was statistically significant. Endothelial cell count loss at the end of 3 months in group A was less when compared to group B, and it was statistically significant. Central corneal thickness was increased in group B in the immediate post-op, and at the end of 3 months also it was statistically significant. Macular thickness was increased in both the groups. It was not statistically significant, and it resumed the preoperative values at the end of 3 months. To conclude, ACDD allows easy and fast emulsification of soft cataracts. It has better surgeon comfort. It neither requires specialized instruments nor higher-end phaco machines. It also utilizes less phaco time and energy, thereby less damage to the corneal endothelium. Thank you.
What was the grade of these cases? Grade of nuclear sclerosis?
Sir, 1 and 2.
1 and 2.
Yes, sir.
And what was the age of these patients?
Sir, it was less than 50, sir. 50 years.
Yeah, young patients.
Yes, sir, young patients.
For soft cataract, do you need all this difficult instrumentation, because that is going to increase the chance of complications more, no? What is your opinion?
Intralenticular manipulations, when you can do a very nice aspiration of the center and then tuck the nucleus so nicely in a single flip.
Sir, in our setup, we have a peristaltic AMO compact phaco machine, sir. Yeah.
That's a good phaco machine. No.
It's not easy to soft cataract to divide into
The video which you showed, na, that it fractured with the two
Yes, ma'am.
dialer, but when it's very early soft cataract in NS1, it's not easy to fracture it. The only one video have. Please collect all your cataract cases, and so if it comes out so nicely, it doesn't happen actually.
This was not a soft cataract. The
This was
video
not the
has
one.
shown 2+.
Yes.
Okay.
Anyway, it was a nice presentation.
Thank
Okay.
you, sir.